All right, so before I haven't done my journal 2 for MN662 therapy. So I want to make sure I get it done. So I'm in 2 clinical classes, and I think that I'm getting both of them mixed. So I will definitely do a better job to make sure that I go in and I look at my videos and I look at my assignments moving forward. So my journal for week 2, this is to discuss a patient interaction in which there was transference, counter-transference, prejudice, bias, or judgments that you may be making about the patients or that they are verbalizing about you. So in therapy, this week and last week, there's a mom that our preceptor has been following, and last week she talked about how her children have ADHD and they're in a what's it called, the school plans, when they have a need for an individualized, man, I have it in the tip of my tongue. It's not IOP. It's an individualized plan of care at school, so that they're in a different like class, or they have different rules, or they have different times to do testing. And she was talking about how they're not giving her the plan anymore. They're wanting to put her in, like, she called it general population, because they were doing so well and they wanted to see that the kids could acclimate. And so she just went on about how the schools are not helping her, about how her children need the help and that they're diagnosed, and she's working, but then she was told by a friend that she can get disability for her kids, and she needs these diagnoses and these individual plans at school to show that they're special needs so that she can get Social Security for them. They have respite care. And so this was a little bit of like a judgment for me, because I've worked with kids before, and I've worked with parents before that are on Social Security. And a lot of the times that I have seen, it's like the parent isn't involved in their special needs care. So Social Security is so that the parent can stay home because the child needs extra care and take care of their kids, and, continue the education they give them, like if they're autistic or they're severe ADHD or whatever the case may be, that the parent who's a nurturer can not work and stay home and take care of the child, which would be a better outcome than a school that doesn't know how to take care of these children. But this mom seemed to just go on and on about how she wants this money and how this is going to help them. And so my preceptor was like, okay, well, send me the information and I can see what I can do to help your children, because I do therapy for them as well, and see if I can help you with this, plan that they need for school. She needed a letter from the child's therapist, but they hadn't seen a therapist for over a year. So my preceptor was like, well, I can see them, send in the information. So the mom did. She sent all the information in, and we saw them today. And she's just going on and on about how, like, she really needs this diagnosis and she really needs this plan, and this is, going to help her get them a house versus an apartment, and get her a van versus an old beat up SUV, and how this is going to help her take them on vacations because they deserve to go on vacations like the ocean. So my preceptor was like, well, do you have time for yourself during your respite hours? And she slipped up and she said, well, I don't have time for myself, even the 20 hours a week for each kid. And she goes, well, that's what respite is for. You're supposed to have, time to give you time as a mom to step away from your job, and she says, well, how can I have respite care if my mom is 70 some years old and is the respite care taker, and we use that money. And then she caught herself, and you could see it in the telehealth. She's like, um I do actually. She's like, I do have time to like go to the park and read and take care of myself, during those hours, because that's what it's meant for. And my preceptor was like, are you sure that this is what you're using the respite hours for? She's like, yeah, it definitely. And then she hung up. And we tried to call her back, and she wouldn't answer. And it was like, yep, she got caught. Like, she is using these kids for the money. And then the respite care hours are apparently being used for something else. And so a little bit of prejudice on my end, because I've seen it before. I would go out and do the annual assessments for the Social Security kiddos in Texas. And I would see this every day. They were dressed at their best, and the home was so clean, and the mom was home, and everything was going, great. And you could see the kids are like, Mom, this is not what happens every day. And they would, play the part to get their benefits. But then, and they were schooled, because you ask the kids, like, how are you attending therapy? Like, how is that helping you every day? Look at mom. And mom is like, remember we were doing this? And the kid's like, oh, yeah. Yeah. And then looking down. I mean, I was there to qualify for Social Security, but as a therapist seeing that today, like, not at myself as a therapist, but my preceptor, it's like, wow, and it gets to me, because you use your kids for a paycheck. That's how I felt, and I felt like I was being prejudiced towards this mother. But my preceptor is like, we do our part, we do our assessment, we get the records from the previous doctors and wherever these children were seen, and we do our assessment based on that. And so I got up and I was like, yeah, okay, remember, I'm not going to change the world, nor am I here to change the world. I'm here to make sure that these children are safe and they get the benefits that they deserve. So a little bit of a bias there. Have you encountered this before? Okay. And from where does this originate? Um, all right. So where does it originate? My parents are immigrants. Well, my dad is. My mom is from here, and we were taught to work. We were taught to. I was taught to do your best, work for yourself. Don't rely on benefits. Help those that you can. You're your kids. You take care of your kids. You take care of your family, and I think that's where it comes from. You know, you can work and you can take care of your kids, and if you're home because you were blessed to have that, extra help, then you should dedicate that time to your child. Um, it's not meant to, you know, you leave your kid or you twist the system around so that you have extra income for I don't know what, nor do I care. But if that child looks like they're not getting any better or the services that they deserve, then that's not okay. And would it be appropriate for you to continue to provide care? If so, how will you prevent these issues from affecting? So it's reminding myself that I'm not going to change the law. The law is there. I'm not a lobbyer. I am not a lawyer. I am a nurse, or I'm going to be a provider. Or if therapy is something I want to do, I'm going to be a therapist. So gather the facts, figure out what I can help with so the child is safe and gets what they need, and let the law take care of what the law is going to take care of. I can't lose sleep over it. And so when that was kind of coming back and reminding myself of all the abuse that I see of the system, took a deep breath and said, I didn't make the law. I am here to hear how my preceptor takes care of the situation, which is flawless, give the best care that I can, keep the patient safe, and move on. So, yeah, that's my journal too.